We are start seeing more and more throat cancer, oropharyngeal cancer, mouth cancer, because there increased trend in the practice of oral sex.
Thanks for tuning in to Conversations, coming to you live from the Bluff City. Conversations is weekly wall-to-wall talk about all things Memphis and the Mid-South. Conversations include people just like you, living on the Bluff, doing what you do to uplift the city of Memphis.
Hello, and welcome to Conversations, the podcast. I'm Betty Lamar.
And I'm LaCresha Chism.
Hi, LaCresha. How are you?
I'm wonderful, Miss Betty. How are you today?
I'm very excited. You know, we're kicking off our podcast where we'll be talking about all things Memphis.
Yes.
And, of course, we're going to have our top doctors and political leaders.
Yes.
Community leaders, and people just like us doing what we do.
To uplift the city of Memphis.
That's it.
That's right.
So now our guest today, let's talk about a little bit about what we're going to talk about today.
Okay.
So our viewers can be ready, set, go.
Okay.
Because we do have a top doctor with us today.
Yes, we do. We have our top leading doctor with us today, and we're going to be talking about cervical cancer, fibroids, anything that's leading in the reproductive area for that causes cancer. So we're going to have a wonderful top leading doctor with us today to talk to us about that.
Okay. Now, I don't know if you're going to jump on the fibroids or not, but we do need to know if there's a link between that and...
Yes, because I have so many women, and definitely in my family, that say they have fibroids. So that is definitely something I would like to,
see if that's in any way connected to... So
that's
now,
right.
Without further ado, our guest today is Dr. Joseph Santoso, Gynecology Oncologist. Welcome to Conversations.
Thank you.
Okay, now, before we get this started, tell our viewers and our listeners who Dr. Joseph Santoso is as it relates to our topic today, because we need to know about our reproductive organs and how not to get cancer down there.
Sure. I've been a GYN oncologist in Memphis for about 21 years and been a professor at University of Tennessee and also director of GYN oncology now at Baptist Medical Group. And I'm thrilled to be here and love Memphis and enjoy taking care of my patients very well. I practice at Baptist Hospital, Baptist Woman, Baptist East, and Methodist Germantown. And my office is just in one location in the Baptist complex.
Okay, now, Dr. Santoso, you know, this is not our first rodeo, right? I tell everybody, Dr. Joseph Santoso is my medical mentor. Because of you, Medical Talk has been on the air now. LaCresha, I think we started in 2011, 2012. I tell everybody I thought it was going to be a boring conversation.
Right.
Until Dr. Joseph Santoso took the stage.
That's right.
And I learned something.
All right.
So I'm like, okay, this is important. Okay, so let's talk about the various gynecologic cancers, and then we're going to break them down one by one because I think they're all different, right?
Correct.
Okay.
Let's start with more common to less common.
Okay.
The most common gynecologic cancer in the United States is uterine cancer. And mostly because of we're being overweight. When we're being overweight, our fatty tissue making hormone called estrogen but via aromatase enzyme pathway. Estrogen is hormone that women have to have. But when you take it excessively, either you take it by mouth or endogenously you reproduce via excess fatty tissue, it become excessively stimulating for production of endometrial layer. That is a layer that women shed once a month. But when you have too much of it, it grows and grows and eventually become cancer. Now, in state of Tennessee, Memphis has higher populations overweight women. And I'm seeing a lot of my patients have this kind of cancer. That's the bad news. The good news for uterine cancer is it is symptomatic. So many women will start to have menstrual irregularity. And usually we do biopsy and we pick them up early. So this is one of the message. Uterine cancer is very common in Memphis, Tennessee, in Mississippi, Arkansas, because we tend to be overweight. The good thing is it has symptom, which is irregular bleeding, especially in postmenopausal women.
So
the
that's one of the ones that you can detect
yes.
pretty early.
So the message to your audience would be, if you have irregular bleeding, do seek your physicians, nurse practitioner, and others. So this could be picked up early or could be ruled out early.
Okay. I want to jump in there. Okay, you mentioned, what is it about the stomach, that part of when a woman have that stomach down there, when they're like obese, and then the stomach, what does the stomach have to do with a woman getting cancer in that area?
It's more on the fat content. So to be overweight, we have fatty tissue in the abdomen, behind, everywhere else.
Okay.
So those excessively will make more estrogen than normal.
Okay.
And that's what causing the cancer. There are two types. Well, think of it this way. Uterine cancer, the most common is the lining of the cancer called endometrial adenocarcinoma. And that is weight-related, most of it. And there's another part that you touch a little bit about fibroid.
Right.
It's called sarcoma. It looked like fibroid. The X-ray looked like one. The symptom may be one. But it's very, very, fortunately, uncommon.
Okay.
So most women have fibroid. Less than 1% of women suspected to have fibroid actually had this sarcoma.
Okay.
Okay, so when does a woman normally arrive in your office? Is it because she has already been diagnosed with gynecologic cancer, or do you find the cancer when they get to you? How does that work?
Both.
Okay.
We have, fortunately, in Memphis and surrounding area, very astute clinicians, physicians, nurse practitioner, physician assistant. They picked it up. If women have irregular bleeding, especially postmenopausal, which not normal,
Right.
then many
yes,
of them will do endometrial biopsy.
Okay.
Pap smear will not pick this up. So you have to do an endometrial biopsy, which is, if this is a uterus, cervix, and this is the vagina, the pap smear is smearing or obtaining cytology or specimen outside.
Okay.
The endometrial biopsy, we go in all the way in.
So if you're just going for annual
You won't
pap
pick that
smear,
up.
you will not detect it. Okay.
Correct.
Okay. I think that's why when I went to my gynecologist at the VA, she always ensure
Right.
that she do
Those
going
specific
back
testing.
we're going to talk about this in a little while, but the HPV, because after interviewing Dr. Santoso,
Right.
I need to make sure that I'm
Right.
being not just checked for the little outside area.
Right.
Can you pick up all cancer from just the pap, or is that why some of the cancers can be missed? Because
You need to go more in depth.
yeah, look, this is what we're going to do. We're going to pay the bills,
Okay.
and we're going to come back, and we want Dr. Joseph Santoso to take us into the next, what do you call it, most, I guess they're all serious,
Yes.
right?
Right.
To us, they are. If it's all
But-
just down there, it's serious.
The sexually transmitted
Yeah.
diseases that we can get.
Yeah, that's what we're excited
That's
about.
what I'm
right?
excited about.
Okay, we'll be right back. We'll be right back after this word from our sponsor with our very special guest, the master, Dr. Joseph Santoso.
Today's show is sponsored in part by Supreme Hot Wings. Supreme Hot Wings, celebrating 13 years of serving the most flavorful wings in the Mid-South.
Welcome back to Conversations. Betty?
Yes, I am enjoying this conversation because, this show originally was my purpose and our goal was to talk about issues, related to women.
Yes,
So I immediately said we have to have Dr. Joseph Santoso
absolutely.
because we do have female reproductive
Reproductive.
organs,
Yes,
right?
that's right.
So this need to be our lead out,
Yes.
our debut conversation,
Yes.
right?
To educate us on these things.
Yeah. So now what do you have to, I know you mentioned the cervical. So I want you to talk to our guest again, Dr. Joseph Santoso, because I know you have a lot of questions and you want to know about HPV because I think that was sort of new to you when I
Absolutely.
mentioned
It truly was. And HPV was something that I really wasn't aware about. But I do get the understanding that you can get HPV once you actually start being sexually active. So, can you touch a little more on HPV for us?
Be happy to. HPV stand for human papillomavirus. It's a DNA virus, very very common because it is sexually transmitted infection. That's the bad news. About 80% of sexually active men and women have it.
So, basically, if you were a teenager and you started being sexually active, HPV,
You probably get it.
you can probably get it. Okay.
That's the bad news. The good news is our immune system in most healthy adult and teenager, if they become sexually active when they're teen, able to get rid of it or suppress those HPV.
Now, is it something that your body can naturally fight off, or is it something that you will have to go in to see a physician for?
No, we are lucky to be created this way. So
Okay.
our immune system are pretty powerful to clear most of the HPV infection.
Okay.
However, if you picked up the high-risk HPV and then you're chronically infected by it, then it will lead into precancerous lesions, which hopefully be picked up by pap smear. If it's not, then become cervical cancer.
Okay. And how common is it for it to turn into cancer if it's untreated?
If we don't do anything about it, they will eventually become cancer. The good thing in the United States, we are a rich base country, so we're able to screen. And in the last few years, we are also lucky to have a vaccine,
Okay.
which is very effective. HPV vaccine, there are two types. There are three types, but mainly historically is the Gardasil 4 that protecting us from 4 HPV, but now it's Gardasil 9, which help us protect from 9 HPV types.
Okay.
The HPV vaccine, if it's taken before sexual debut, is effective in reducing cervical cancer by 90% and reducing genital wart by 90%.
Okay.
It's huge.
It's huge.
And it works both in male and female.
Okay.
So speaking of male, I'm going to jump in
Okay.
because males sometimes we are talking about women and cancer, but men sometimes sit back. They're all cool about this because they think it's a girl
Right.
thing. So, what's the prevalence of men, to your knowledge, that get penile cancer? Like some men would say, "Oh, well, that doesn't sound interesting." I said, "It sounds interesting if we throw in the penile cancer."
Right.
Then now the antennas go up.
Right.
It's just not the women that are dealing with
Dealing with
HPV.
HPV.
So, do you all have any statistics on men and how they're affected with cancer, especially the penile cancer?
This is unfair. The man,
It is, you're right.
the
It
man
is.
doesn't
I know,
really
right?
doesn't really get much penile cancer.
They
Okay. Wow.
It's not fair. It's because of the man is more
Is it more
Like-
because it's outside?
like the mosquito.
Right.
They infect the woman and they kind of go on their
Right.
own. The reason is the anatomy.
You know?
The woman's cervix has so-called transformation zone. That means from a stratified epithelium, which is almost like our skin, and become glandular. And that's how a woman is made. And in that area is very prone to HPV infection. And because that area is more rapidly dividing, more prone to genetic errors that could be caused by the HPV and leads into cancer. Male reproductive organ, on the other hand, is pretty much stratified epithelium, so it's more resistant. So men tends to infect women, but they are also prone for genital warts. So
Okay,
they're
I
not
was gonna
out
touch
of
on
the
that.
way completely.
So can a woman see them
Yes.
on a
Yes.
man?
For genital wart,
Yes.
but not if they are just having HPV infection in their penis.
Okay.
I want to lead into another part. We are start seeing more and more throat cancer or pharyngeal cancer, mouth cancer, because there increased trend in the practice of oral sex.
Right.
So this could occur both in men and women of having oral cancer or mouth cancer or throat cancer related to HPV.
Okay.
Okay, so wow. Is that why, like, when I go to the dentist, they always look, when they looking like around in your mouth at your gums, is there some kind of indicator that they see that when you're looking around? Because I notice they always examine inside my mouth,
Right.
almost looking in your throat. Is there a reason for that? Are they looking for that?
Are they able to detect
cancer?
cancer?
I don't practice dentistry, but I'm sure that's part of ruling out gingivitis, tooth problem, as well as any lesions. If there's any lesion that's suspicious, I'm
Okay.
sure your dentist will refer you to another physician for
physician.
Yeah,
biopsy.
because
Okay.
I thought about that when you mentioned the mouth and the throat and all that.
And
So-
you yourself should
Yes.
also pay attention. When you brush your teeth, do look inside.
Okay.
Look at your tongue, under the tongue.
Examine
If you
yourself.
have, if you have difficulty swallowing, do seek physicians right away.
Okay.
I was going to ask, what are some of the symptoms? I know you deal with, down here, but are there symptoms? Because I had like this severe sore throat back at the beginning of COVID, but they say it wasn't COVID. I just had such a severe sore throat that my vocal cords are still
Healing from it.
strained. Yeah, it's like, and that's been almost 2 years ago.
Right.
But I'm going to get a scope so they can just look in there. So, what are some things to look for up here or down there that, other than the bleeding, that we should be looking for? Let's go back down here that we should be looking for in the gynecologic, like those signs and symptoms, I guess is what I'm asking.
The most common symptom is painless, no pain.
Wow.
But usually it's a postcoital bleeding. That means after sex you have spotting. Now, most of the time it's common, especially in postmenopausal women. You lack estrogen, you lack moisture in that area, so it tends to
okay.
bleed. But that's what we see. Women cannot really see it down inside. But as a GYN oncologist, when I have cervical cancer patients, when I open that speculum, I usually could see ulcerations or exophytic growth, like polypoid lesions. In that situation, I just would go ahead and biopsy it.
Okay. Is there a certain age that you should be looking for this?
After the sexual debut, if there's no treatment, no screening for cervical cancer, then it probably takes about 10 years or so,
Okay.
5 to 10 years, to become abnormal or dysplastic growth.
Okay.
Dysplastic means abnormal cell growth. And then another 5 to 10 years to become cancer. So we have plenty of years to pick it up. This is why
Okay.
pap smear works very effectively, because we are able to repeat it several times. And if we miss one, we picked it up
Pick it
at
up
the
on the
next
next one.
part. The problem is in the United States, we don't have this unified screening center. So people move from one doctor to the other or move to a different city,
Yeah.
different
Right.
state. So we don't have those record unified. And many times I would have patients saying that I had abnormal pap smear 2 years ago.
Right.
And I says, what kind of abnormality?
Right.
And we have no idea. So we have to start over again.
Okay, now we're going to jump out
Okay.
for a moment. This is so good. Are you learning something?
I am learning a lot. It is a very intriguing episode.
Okay, good. Okay, well we'll be right back after this word from our sponsor with Dr. Joseph Santoso, and then we're going to go even deeper into our reproductive organs, because if there's anything that we can do to prevent, we need to know about that. We'll be right back.
AM Diabetes Center is proud of its first-of-a-kind fitness center in the nation, designated for people living with diabetes. If you're not sure if the effort to lose weight is worth it, consider this. Your weight can significantly contribute to causing diabetes or preventing it. An essential part of diabetes management is weight loss. The team at AM Diabetes and Endocrinology in Bartlett, Tennessee offers ongoing nutrition education and weight loss support for patients and non-patients alike.
LaCresha, I'm so enjoying this show with Dr. Santoso. I don't know about you, but I'm learning stuff.
Very much.
And I'm learning so much that we're just going to turn it over
Back
to Dr. Joseph Santoso,
That's right.
so he can take us into ovarian cancer,
Yes.
because that is like
One of the most common cancers that we
it's
are
it's
having.
just it's I'd like to use this word. Cancer can be deadly.
Yes.
So we're going to turn it over to you again, Dr.
Okay.
Joseph Santoso, because I know you have a lot of new. There are a lot of new things, if you will, going on out there that we need to know about. So the
Thank you.
stage is yours.
Yes.
For ovarian cancer, it's unfortunately, like you says, a deadly cancer because we picked up by the time we see the patients is stage 3 and 4. Cervical cancer, we have a screening test like pap smear and HPV testing, so we picked them up early. With ovarian cancer and cervical cancer, fortunately, we have newest thing.
Okay.
Okay.
The usual treatment is surgery in the early cases, and then we follow with cervical cancer, we follow with radiation. For ovarian cancer, we follow with chemotherapy. Unfortunately, some of our patients continue to progress or have recurrences. And usually in the past, we treat them with chemotherapy, but many of them will pass away because the cancer become resistant to chemotherapy. The exciting thing is two things. Number one is called immunotherapy, and the second one is called antibody drug conjugate. And both apply for both cervix and ovarian cancer. Immunotherapy, we learn our bodies actually could kill cancer. But cancer also evolved developing a receptor to blunt our T cell. Our T cell are the one that able to kill bacteria, kill cancer, kill viruses. So we developed a class of treatment called, one of them is called pembrolizumab, and it's basically unmask the cancer cell so the T cell, our immune system, could recognize it as foreign and kill it. And the good thing is also much more tolerable than chemotherapy. So for our audience, if you or your family have progressive cancer, think about immunotherapy, and one of them is called pembrolizumab. And that is an antibody to unmask cancer cell so they could be recognized by our immune system and kill it. The second class that is really new for both cervix and ovarian cancer is called antibody drug conjugate. And we learn cancer cell have receptor that unique differentiate between cancer and normal cell. So there are companies that develop an antibody that hone in into that receptor, and then it cross-link with a chemotherapy. So once you have a cancer cell with receptor, one of them is called folate receptor, and this antibody will grab into that folate receptor, and it activate the cancer cell to grab into that combination of antibody with chemotherapy, swallow it, called endocytosis, and then kill the cancer cell. So the purpose of that is we're hoping it become less toxic rather than just carpet bombing the whole body with
Yes,
chemotherapy,
yes.
you use this very targeted. So
Yes.
again, in summary, the two updated things about ovarian and cervix is immunotherapy and antibody drug conjugate.
Okay.
Okay. Oh my God, this is so good. You know,
Yes.
and I thank God because medicine has come so
Such a
far.
long way.
I mean, we still have a long way to go.
Right.
But it's just the fact that, God forbid, someone. Oh, quick question before we wrap this up. Does a woman have a choice to get the? You said is it the immunotherapy or whatever? Okay, so does all doctors recommend that,
We have
or
pretty
just chemo?
usually for cervical cancer, we give chemotherapy, targeted therapy called bevacizumab, and pembrolizumab, the immunotherapy. So that's the first line if you have metastatic or very advanced cancer.
Okay.
Is
you
one more aggressive than the other?
No, it's a combinations.
Okay.
So we learn that the chemotherapy work, but not as good.
Right.
But then we add a targeted therapy called bevacizumab. It
Right.
works better. And then there was another study showing that if you add the immunotherapy plus targeted therapy plus immunotherapy, you actually get four of them. It worked even better.
Okay.
Okay, now Dr. Joseph Santoso, today has been a wonderful podcast.
Absolutely.
And I know that a lot of people will learn a lot from this because I most certainly did. And in closing, LaCresha,
Yes.
we're just going to wrap this up. I want you to thank Dr. Joseph Santoso as well.
Absolutely. Thank you, Dr. Joseph Santoso, for visiting us today and educating us on cervical cancer and all types of cancers that we can get in our reproductive organ systems. So thank you so much for joining us today.
My pleasure.
All right.
Okay, and I just want to thank everyone for watching and listening Medical Talk since, I guess, 2012. And we really thank you.
Yes.
And stay tuned. Conversations, we're just hitting the ground running.
Yes. Thank you.
Thank you, LaCresha.
Thank you, Miss Betty.
All righty. See you next time.
That's right.
Thanks for listening to Conversations with Betty Lamar. Visit our website, www.thebettylamarshow.com. Email betty@thebettylamarshow.com. Subscribe to our YouTube channel, Betty Lamar Memphis.
It's just, and it's just small little achievements like crossing my legs now.
I
Right.
see.
Yes.
Yeah, you're doing it too.
Yes,
My
indeed.
heels back on again,
Yes. Right.
And people, you walk by people and you speak to them and they go, hey. And it's people you've known all your life.
Right.
And they like,